welcome to our exciting event here in Washington, D.C., Connections at the Capitol, discussions on loneliness, isolation, and the path forward. In honor of Global Loneliness Awareness Week, held each year in June since its founding by the UK's Marmalade Trust in 2017. My name is Jillian Racoosin, and I proudly serve as the Executive Director of the Coalition to End Social Isolation and Loneliness. The Coalition's mission is to engage diverse stakeholders, increase public awareness, promote innovative research, and advocate for policy change that combats the adverse consequences, social isolation and loneliness, and advances approaches that improve social connectedness for all Americans. Last month, the U.S. Surgeon General released the first ever advisory on the pandemic of loneliness and isolation and the healing power of connection. The advisory proposed a national framework for tackling loneliness and building a more connected society. We are proud to be a part of history in the making. Together with our members and partners, we have created a tidal wave of momentum, reflected in the dozens of conversations with lawmakers and federal leaders held in just the last few weeks alone, including dozens of meetings this week and even today with bipartisan and bicameral leaders. We take a moment to thank our partners as well at the Foundation for Social Connection and the researchers, advocates, and interventionists who work tirelessly alongside us to raise the tide of this issue day after day. The data is clear. Social isolation and loneliness have devastating impacts on our physical, mental, social, and economic health. This issue affects our communities, our loved ones, and people from all walks of life. Social isolation and loneliness were prevalent long before the COVID-19 pandemic shined a light on this crisis. Prior to the pandemic, 1 in 5 Americans reported they always or often felt lonely or socially isolated. In addition, researchers found that loneliness and social isolation lead to an increased risk of premature death. The negative health outcomes due to prolonged disconnection can be compared to those of smoking up to 15 cigarettes a day. Additionally, these conditions are associated with increased risk of chronic lung disease, arthritis, impaired mobility, depressive symptoms, self-neglect, and elder abuse. Aside from health impacts, we now know that loneliness can be a barrier to other sectors of society, including workplace productivity, job dissatisfaction, and reduced civic and cultural engagement, to name a few. Like most aspects of health and well-being, factors including race, age, gender, identity, and income level play a large role in how individuals and communities experience loneliness. For those reasons, today we will hone in on a few key populations, particularly at risk of social isolation and loneliness: moms and caregivers, veterans, and young adults. In partnership with the National Awareness Campaign Far From Alone, today we have put together a focused agenda to illuminate the detrimental effects of loneliness and isolation and how our ability to connect and promote belonging impacts our ability to thrive. We will hear from federal and state champions, thought leaders and change makers, those with personal experiences, and those who are working to create more socially connected communities. We are honored and grateful that you have joined us here today, either in person or virtually, to come together to recognize Global Loneliness Awareness Week. We are thrilled to be engaging in these critical discussions and look forward to continuing our dialogue long after today's event concludes. Before I turn to our next speaker, I'd like to remind our in-person audience that today's session is being streamed to a virtual audience and that our microphone in the center here is capturing the audio in the room. With that, I am happy to welcome Andrew MacPherson, founder and board chair of the Coalition, who will speak about the history of CESIL and our collective impact.
Well, thank you so much, Jillian. And first of all, welcome everyone. It's great to be back together a year later. We've made so much progress since our event last year. As Jillian said, my name is Andrew MacPherson, and I'm the founder and the chairman of the Coalition to End Social Isolation and Loneliness. First off, we are so fortunate to have Jillian leading our coalition as executive director. I want to personally thank Jillian for her hard work, her dedication to addressing the crisis of social isolation and loneliness, not just in America, but globally. She's just doing a terrific job. I also want to thank our just extraordinary team at the Coalition and the Foundation. Each of our team members brings a passion and a drive and a commitment to our work on this issue. Thank you for all that you do. You heard that passion and drive from Senator Murphy just a moment ago. I really feel like we're in the moment here together. And it's that same passion and concern that led me to found the Coalition and now chair it in 2018. As Jillian said, the coalition is a not-for-profit, nonpartisan organization dedicated to increasing public awareness, promoting innovative research, and advocating for federal and state policy reforms to combat the adverse consequences of social isolation and loneliness throughout the U.S. and also globally. As Jillian said, our coalition consists of a whole range of diverse stakeholders, all committed to addressing the crisis in America, including consumer groups, health plans, community-based organizations, mental and behavioral health advocates, foundations, healthcare innovator companies, and so many more. I'm so honored to work with each and every one of you on this important initiative. You know, in 2018, we saw an important opportunity. When there's a rich evidence base for an issue, when markets start to move, when innovative companies and national organizations begin to pilot and to really act, well, it's time that Washington begins to advocate and activate. You know, and I think that's what we've done together over the past 5 years. Today, we've got over 50 national organizations supporting and participating in our work to get Congress to finally take action. Just this morning, our coalition sent a letter right here. I want to thank Deneen and Rachel on our team for their hard work on this. It's signed by over 60 organizations asking the congressional leadership on a bipartisan basis to pass legislation to address the crisis. So what would that legislation look like? Well, we've rallied around 5 key areas: increasing public awareness of the issue, enhancing social services and supports to address the issue, advancing healthcare services and supports with programs like Medicare and Medicaid, encouraging technology that fosters connection and social integration, and supporting research, and advancing research and funding more research to establish and better understand the prevalence of the issue. All of these areas taken together will build on the administration's leadership on this issue, and especially the Surgeon General's work to comprehensively address the issue. So indeed, from my perspective, and I think our collective perspective, and I think Senator Murphy agrees, the time is now. The health of individuals, of employers, Medicare, Medicaid, and indeed our nation hangs in the balance. So thank you for all of your hard work. Everyone in this room and everybody with us virtually, thank you for your hard work to address this national public health crisis. We can and we will make sure that every person in this country has the opportunity to be socially connected.